This video is about the use and abuse of GHB, and in particular how to manage a presentation related to an overdose of GHB. The GHB is γ-hydroxybutyrate. It's a party drug that's used to get a sense of euphoria and also causes amnesia, and is commonly used as a date rape drug. Comes as a white substance, either as a powder or crystals, but is usually dissolved and taken in liquid form. GHB is actually a naturally occurring substance that is already in the brain, and there's endogenous GHB that everyone has. But when people take it, they either take the pure GHB as a liquid or they take one of its precursors. There's two main precursors that people might take. One is GBL and the other one is 1,4-BD. Both of those get converted in the body to GHB and then have the same effects as taking GHB itself. The main receptors that GHB works on are the GABA receptors, and the GABA receptors are inhibitory receptors in the brain that cause neurodepression. And there are also some receptors specifically for GHB itself, but most of the main effects are at the GABA receptor. The onset is quite rapid, between 20 and 30 minutes. It lasts up to 3 hours, but often might be less than that if they've taken a small amount, or a bit longer than that if people have taken a large dose of GHB. GHB effects are euphoria, coma, respiratory depression, sometimes dystonia and myoclonic jerks, and then agitation after waking is quite common. People can get a bradycardia, but it's usually mild, and people also become hypothermic, so temperature drops. People can vomit. They don't usually aspirate when they take GHB, but vomiting is quite common. And people can get a metabolic acidosis, but this only tends to happen in very large overdoses. The treatment is largely supportive. There's no specific antidote to GHB, and there's no specific test that you need to do because it's not easily detectable in the blood because it's broken down. You might need to manage someone's airway, and that ideally would be done conservatively without the need for intubation. If someone has acute airway compromise, so if they're obstructed or if they started to vomit and they're obstructing their airway, you probably would need to intubate them. But if they're not in that situation, then so-called prophylactic intubation has not been shown to improve outcomes and should probably be avoided. Recovery is often rapid and happens usually within 3 or 4 hours. And this is common for people to go from completely unconscious and not responding, and then an hour later they might be just waking up, and then a couple of hours after that they just walk out of the hospital. You can safely discharge someone when they've been GCS 15 for an hour. You do have to remember to tell them not to drive or operate any heavy machinery for 3 days after a GHB overdose, as there may be some after effects of sedation.